Hello, my name is Kennedy Bass, and today I'm going to be doing a presentation on teen pregnancy among adolescents. I first wanted to start by addressing the population that we will be talking about during this presentation, which will be focusing on adolescence. So, adolescence is a stage of development between childhood and adulthood, generally between the ages of 13 and 19. Usually, this would start around the same age as puberty would. During this period, teens experience rapid physical, emotional, cognitive, and social development. Adolescents begin forming their identity, gaining independence, and making decisions that can affect their futures during this stage. So, now we're going to be moving on to the overall problem, which is going to be discussing teen pregnancy. So, according to the CDC, although teen pregnancy rates have declined significantly over the past few decades, thousands of teenagers still become pregnant every year. A teenage girl who decides to keep her baby is likely to suffer from many consequences. These consequences may be things like public assistance, underemployment, or unemployment, and ending to her schooling. So, a lot of these young teenagers who do become pregnant, they wind up dropping out of school at this age when they find out. Earning another problem could be earning a lower income than those who had children later in life because they are too busy taking care of their child that they just had, and an increased likelihood of having a second child within the two first years has also become prevalent and a concern. So I found both of these quotes in the textbook, but the last quote states a disproportionate number of children born to teenagers show more emotional and behavior problems while growing up. So this shows that it does not only affect the teenager who is birthing the child, but then the child when they are growing up as well, as they are exposed to many unfortunate circumstances rather than if someone would have had a child later in life. Now we'll be talking about macro intervention regarding teenage pregnancy. So, through research, I found a program called Personal Responsibility Education Program, aka PrEP. So, what exactly is PrEP? PrEP is going to be the personal responsibility education program is going to be a federally funded program created to help reduce teenage pregnancy and sexually transmitted disease. And this was found through the Administration for Children and Families. The PrEP is going to be implemented through it could be implemented through public schools or community organizations bringing awareness to the topic, or health departments, or even juvenile centers, since a lot of these teenagers and adolescents are the ones at risk the most for teenage pregnancy. And the goal of the personal responsibility education program are to educate adolescents on one, both abstinence and contraception for prevention of pregnancy and sexually transmitted infections, including HIV or AIDS, and two, adulthood preparation subjects. And these were all found from the Administration for Children and Families. So, what are going to be the strengths and the weaknesses of this macro program? The strengths would be that it uses evidence-based curriculum, which is always the best type of curriculum is evidence-based. And a large number of adolescents can be reached through these programs. So a lot of these programs are in a lot of schools through sex ed and other programs as well, like community outreach programs. And they have the right knowledge to spread awareness to large numbers of those adolescents. And it encourages responsible decision making as well. And it also encourages and teaches information about pregnancy prevention and contraception as what is most effective contraception to use when teenagers or adolescents are sexually active, and it reduces risky sexual behaviors as well through the information that it teaches and increases knowledge about sexual reproduction and health. So its weaknesses is going to be that it's not every school that offers prep or community that offer prep. So a lot of the communities and schools that do not offer them or due to lack of funding, and especially in more rural areas or underprivileged areas as well. Another one could be that students may become disengaged during their curriculum if they do not find it engaging enough. They may, zone out or really not be paying attention. And for more religious students, sex health can be considered very taboo, especially if you're raised in a household that does not talk about sex health and, the contraceptions that can be used to prevent these things. And it's basically just as like a hush hush type of thing in many households of adolescents growing up. So a lot of people might feel very uncomfortable learning about this stuff, even though it can be very useful to prevent teenage pregnancy. So now we're going to be talking about micro intervention. So a micro intervention that I chose and found through the textbook is going to be the Alderan counseling model. So this was developed by Alfred Alder. And according to the textbook, it states that much individual behavior is directed towards finding a place or position in a group. And that is something that Alfred Adler had quoted himself. Basically, just saying that teens and adolescents, their entire existence is just trying to find out where they fit in, basically. And this model encourages goal setting and positive goal setting, which is very important to Alfred Adler. And the four types of misbehavior goals that it had mentioned in the textbook is attention in me, which means that the child wants service and attention. Power, the child wants to be the boss. Revenge, the child desires to hurt others. And inadequacy or assumed disability, the child wants to be left alone. So these were the four types of misbehavior goals that were identified in this specific chapter concerning the Alderan model and how it is implemented. So it's implemented by a counselor who works with adolescents to set positive goals. So this is going to be done through a trained counselor and somebody that has the qualifications to do this. And it focuses on altering adults' responses to adolescents' risky sexual behavior. So it wants to take the stigma and tabooness out of sexual behavior as an adolescent, because it is very normal for adolescents to experience these things. And it focuses on helping young people to interpret the goals of their sexual activities. So, why were they, inclined to do that in the first place? And it wants to alter the adults' responses to parent, teachers, or counselors, and begins with identifying the feelings aroused by the youth's behavior, which could be anger, disgust, resentment, despair, and so forth. And then not acting on those feelings. So, what are going to be the micro strengths and weaknesses of this model? So, the strengths include individualized treatment. So, each treatment plan is catered to each adolescent, and it builds confidence for the adolescents in their goal setting skills and setting positive goals. And it helps adolescents understand the consequences of their actions, and that each action does eventually have a consequence, whether it's positive or negative. Responsibility instead of punishment is also a strength. So that was something that the model emphasizes as well. That it wants to teach responsibility instead of being punished for doing that action, and its goal is to improve family relations as well and strengthen those relations with the adolescent and the parents. It also focuses on changing long term behaviors as well instead of just short term. So, by that goal setting, you want to set these long term goals that are going to be positive and reduce risky behavior that ultimately can lead to teenage pregnancy. So, a weakness could be that only trained people can implement this successfully. So, not everybody can successfully implement the Adler model. It requires somebody that has the right qualifications and everything for that. So it also can take months to see results. So it's not one of those things that you might not see results overnight. It's kind of like a slow burn type of thing for some adolescents. Everybody's different. So some adolescents you might see results right away, and other adolescents it might be you have to be patient and keep working through this goal setting process. And some adolescents may be reluctant to participate as well, just to they might be feeling insecure about themselves and their goal setting abilities. And another weakness would be that less commonly practiced in underprivileged communities. So, as I discussed in the last side, lack of funding is an issue. So, people may not have the knowledge to implement this and practice in underprivileged communities, and they might not have trained professionals there in their communities to implement this. And another weakness would be that some participants may have unwilling parents that do not want to change. So, one of the big common goals is to strengthen family relations within the adolescent to the parent. And that includes, having them, teaching them how to react to different situations and just be a part of their adolescents' lives and their goal setting processes to get them to a healthy road to adulthood. So, this is a list of all the references that were used throughout this presentation. Thank you for watching this presentation, and I wanted to give a quick overall summary of what was discussed. So, we began the presentation by talking about the issue of teenage pregnancy and the possible outcomes and consequences, and how it can affect adolescence. Then we go to move on to micro and macro interventions such as the PrEP and Adler model.